For over 17 years, the founders of Agape Healthcare have set out to establish an organization that creates a higher standard for end-of-life care in our community. I recently spoke with Kelly Bastian, the managing director of Agape, over Zoom to find out more on how they can help. Kelly, I'm so glad you're here with us today. Can you actually talk about Agape and what you guys do?
Thanks for having us. Agape is a private Denver-based practice offering services to people dealing with life-limiting illness, as well as their families, by offering hospice and palliative care services.
So in addition to that, a lot of people kind of misunderstand a little bit about what hospice versus palliative care really is. Can you say the difference?
Hospice care is for people who have a presumed prognosis of 6 months or less to live. It's a philosophy of care that is whole patient-centered, and it's served by a whole team. The goal of hospice is to manage symptoms and keep people as comfortable and alert as possible through their end-of-life process. Palliative care is for anybody with a serious illness or an ongoing illness. It's provided by a nurse practitioner and a social worker, and our goal is to help people manage that illness or treatment, managing their symptoms so that they can live their everyday life with as much quality as possible. Both hospice and palliative care, our main priority is managing their symptoms.
What does that look like, I guess, on a day-to-day basis?
So when people have challenging symptoms, either as the result of their illness or treatment, they don't get to live their lives the way they would like to. Our practitioners and nurses are experts at treating symptoms like pain, shortness of breath, or anxiety, just to name a few. And at the same time, we're offering support through spiritual and emotional and practical resources in the community.
Kelly, I've been wanting to ask you this question. We're really in uncertain times, and you guys really have a pulse on where people are at, especially during very difficult moments. What would you say to people out there today?
I would say to our community that during this uncertain time, it evokes a lot of fears. Fears of being alone, fear of being isolated, and the very real fear of your loved one dying without you by their side. And I would offer to our community, allow care, allow support wherever it shows up in your life. And we'll get through this period of time with grace and love for each other that I know Denver is capable of. And just know Agape's here to serve in any way we possibly can.
If you or a family member is in need of palliative or hospice care, don't hesitate to call Agape at 720-482-1988. You can visit their website at agape-healthcare.com for more information. That number again is 720-482-1988.